Hello and good morning, everyone. This is Mike Gatorna with Health Agents Network and in collaboration with Bankers Online Training. I'm excited today to talk to everyone about becoming a local area expert, become a known name for insurance in your community. Now, we're not going to just review dry material and some suggestions that may or may not work. These are tried and true methods from both myself and other agents I've collaborated with in the field and what we have done to become known names in our community. So again, if you have any questions, comments, concerns, threats, or promises, feel free to throw them in the question area of the user panel. We'll address them as we go along. Otherwise, we'll have live Q&A at the end. This is being recorded too, so you will be able to find this on Health Agents Network and Bankers Online Training if you want to review or share it with another insurance agent. But we're going to jump right into it and learn how to dominate your local market. So these are some ideas that either, again, I or other agents I've worked with or know personally have done that help create a name for themselves in their community. We're going to talk about professional networking, which I think is kind of a lost art or something that we could definitely improve on as an insurance community, collaborating with other professionals. We're talking about doing seminars, social media, which obviously is a key thing right now, has been for a while, and definitely something you want to be part of. Advertising, local publications, and also they have a special bonus that we're going to talk about NAP consistency with Google and how to become more relevant on Google searches. So we'll get to that at the very end. So let's go ahead and get started. Professional networking. You want to make sure that while you know you're a Medicare expert in your community, not only your clients know that, but other professionals, because your clients and your prospects work with other people other than insurance. They may, work with a P&C agent, a CPA, estate planning attorneys. These are people that work directly with your clientele that you want to make sure if they have Medicare questions and they're asking their CPA or their estate planning attorney about them, and they may not know that they know, direct them to you. And it's also vice versa. If you have someone ask you about taxes or creating a will or how does this affect my trust, you want to make sure you have the resources for your prospects and clients to give as well. So it definitely can be a very reciprocal relationship. I would advise to keep it just reciprocal. Don't include any money. When you include referral fees or something like that, it can get very ugly very quickly. And a great way to lose a friend or a fellow colleague is to involve money. So just make it reciprocal. Hey, give me some information about you. I'll give you some information about me, and we could just trade as we go along. In that way, it's nice, it's clean, it's just more of a resource rather than a monetary exchange. Another thing that a lot of agents do that I think we could definitely do better at is joining local organizations such as the Chamber of Commerce. And I hear all the time, but Mike, seniors aren't going there. That's not my target demographic. And while that's sort of true, this is one way to get your name out maybe in front of an estate planning attorney or financial planner or CPA, the people that don't deal with Medicare directly but deal with seniors. It's also a way to just be known in your community. I'll share a true story of myself. I went to a Rotary meeting as a speaker, did a quick presentation on changes of Medicare and the basics of Medicare, and at the end I had someone come up to me and say their mother was aging into Medicare in a couple months. Could I help them? And sure enough, I was able to. So not only are you becoming a local expert in the eyes of other local experts, you're also being a resource for them as well, because a lot of these professionals, they're in the 50s and 60s. They probably have aging parents on Medicare, or maybe they themselves are going on Medicare as well. So don't just think that, that's just other business professionals, or business professionals have clients as well and have family and friends as well that could use your services. Now, pharmacies and doctor offices are a great way to get out there and get your name known. And doctor's offices could be a little tricky, especially in more urban areas, more populous areas, because you are competing against a lot of other agencies. You're competing against, pharmaceutical reps, DME reps, which is durable medical equipment. You've got your home health companies, your hospice companies, all these other organizations that depend on doctor referrals or sell programs or things to doctors. You're competing against them. So it's a very touchy market, but in the more rural markets, I hear a lot more success stories. I personally never have, but definitely one thing you can do is if you have your own doctor should know what you do for a living, and they should know to refer their patients to you if they have Medicare questions as a professional referral, not a paid referral. Same with pharmacies. A lot of pharmacists don't have time to run Part D plans when it comes to AEP or to do these massive drug lists and really advise people because they might not understand it as well. So it's good to go in there and just be a resource for the pharmacists. If you have clients who have questions about what's happening in Part D, let me know. I could definitely share that information with your clients. Here's a stack of business cards. And just get that professional relationship. One thing to caution on are some of the smaller pharmacies are worried that you're going to sell or offer a program that will take out the local pharmacy. This is a concern I heard of a lot from smaller communities or more mom and pop pharmacies, if you will, is that, you go in there with a plan that has your own mail order company. What's the motivation for the person to still use that local pharmacy if they're getting really inexpensive drugs through mail order? So be prepared to answer that question of, the personalized service. You never tell your clients to stop using local pharmacy because they're going to get far better service there, and so on and so forth. So just be prepared to answer that question if you're dealing with a more local, home-based pharmacy. So definitely go out there and let other professionals know what you're doing and make that reciprocal, because you become a resource for their clients and vice versa. So definitely professional network. Does not hurt. So get your name out there, network with others in your service field. Again, do a referral network, and then again, be a resource. Don't just be a salesperson, be a resource. Because the more resourceful you are, the more phone calls you're going to get, and through the power of numbers, the more you'll be in front of people and more sales you'll achieve. Now, one thing I did personally was seminars. I did a lot of seminars, and a lot of these are just basic one-on-one seminars, either a local library, community center, and again, with professional networking, you could do joint partner seminars. So don't be afraid to partner with an estate planning attorney, or if you partner with a CPA or maybe even a doctor. I did a seminar once with a doctor, and it packed the room and then some because they wanted to hear what the doctor was talking about. So if you could get in front of a doctor that's maybe newer and building their practice, that's a great way to fill a room. If a doctor, of course, will do that with you. But you could do a new to Medicare 101 or a monthly Medicare update. These are great because it gives a nice neutral source for your prospects to go to. You could also tell your current clients that, hey, every third Wednesday at the local library, I do a basics Medicare and any updates in the market seminar. It lasts about 20 minutes. Come on in, bring your friends. It takes some time to build up. I will say that. You're not going to host your first seminar and have 50, 60 people show up, but the more you do it, the more consistent you are, and the easier it is to remember, the more people show up. So it's one of those things where you're sitting down at the kitchen table and you're talking to your clients, or they're in your office, and you say, hey, don't forget, every third Wednesday, I'm at the local library at 10 o'clock talking about Medicare. So feel free to bring your questions, bring your friends, and it's, again, a nice neutral way for your clients to bring their friends to introduce you in a nice setting that they're not going to feel pressured or anything else. And also, one thing that it does for you, it establishes you as an expert, because who does seminars? Amateurs don't do seminars. When you go to a seminar, you expect the person presenting to be a professional and be an expert. So it gives you that persona as well. And hopefully you are an expert and a professional. Of course you are. You probably wouldn't be sitting on this webinar, but it gives that persona. So that's a great way to say, hey, I do monthly seminars. As wow, this person really is involved in the community and really knows their stuff. You could also do ancillary products as well if you want to. You could do hospital indemnity plans. You could do final expense plans, so on and so forth, to talk about other areas of insurance that your clients and prospects may not be familiar with. Now, one tip, the question I get all the time is, what about Medicare Part C and D plans? There's a lot of compliance goes with them. As long as you are talking on a very high-level basis, in fact, the question just came in, what about Medicare Advantage and Part D plans? So here's what you have to do. Treat the seminar like you're reading out of the Medicare New Book. Be very high level. Don't mention any specific carrier or any specific benefits. Just, again, talk like you're talking on the Medicare New Book, and you'll be fine. You don't have to register it. As soon as you cross that bridge into a specific benefit, such as a premium or a copay, or you talk about a specific carrier, you have to register that event. But if someone asks you in the audience, what about this plan ABC that I keep hearing about, you could say, you know what, this seminar is not designed to talk about any particular plan, but see me after the event and I can go over the details with you. And then you can pull out a scope at that event and you can have them sign it and continue the conversation. Just don't do it in the public forum. So great question, very big concern, especially since, CMS is out there doing secret shops. So again, partner with other professionals. I partnered with a estate planning attorney as well, and we did, living wills and how Medicare affects your living will, which it really doesn't, but most people don't know that. So they were able to learn about living wills and Medicare. And that's the nice thing too, is maybe you have prospects that don't know, they need to know more about Medicare. They want to know more about estate planning or living benefits or something else. That's a great way to pull people in, and then maybe you could spark their interest with your side of the seminar. So other health services, continuum of care places, these are, your skilled, independent, and assisted living communities are all in one. You can do partner with home health care. You can do diabetes, partner with diabetes programs out there. I guarantee if you live in a halfway sizable community, there are probably diabetes programs out there, maybe even nonprofits that you could partner with and be a guest speaker and just be viewed as a professional. I can tell you I worked with a rehab facility in Kansas City, and I got phone calls all the time about Medicare. Half the phone calls I couldn't help the people, but it gave the rehab center a place to call, and I did get sales out of it. So definitely partner with these outside organizations, even if it isn't your direct clientele base, not just seniors. Still, the more people know about you, the more people talk about you, the more your phone will ring. Social media, of course, this is a hot topic. It's a great way to get in front of a lot of people with minimal effort, actually. So Facebook, let's talk about Facebook real quick. I would suggest reposting local events. You don't want to go on Facebook and just promote yourself and promote yourself and promote yourself, because guess what? People will start blocking you or ignoring you, because most people go on social media or Facebook, I should say, for more personalized things. They don't want to go there and see a bunch of commercials. So I would say 5 to 10 posts a week to stay live in their newsfeed and post interesting stories, maybe some stories about Medicare in the news that you didn't produce, and you could do that through a news aggregate. I'll give you a tip right here real quick that I do to keep up on Medicare. I set up a Google alert that every day I get a Google alert about Medicare, and has about maybe 10 stories in there about Medicare. Some are relevant, some are not, but then I can pick the stories I like and repost them. So that's an easy way to do it. All you do is go to Google, go to news, type in Medicare, scroll to the bottom and say create an alert. And you can create a daily alert. So every day you get a Medicare story, and it gives you something every day to post on your social media feed. And then every now and then you could go ahead and post something about yourself. One thing you can do is talk to your clients and prospects, say, hey, I'd love to mention you, that I met with you today and I'm happy to be your agent. Do you mind if I tag you in a post? And they may say yes, they may say no, and that's fine. Even if they don't, you could say just help the person in ABC community, looking forward to being their agent, and something like that. And if you're looking for more things to post, go to healthfinder.gov. Lots of information on there that you could post, and they actually have a social media section that is all set up to repost things as well. So there are resources out there. A lot of agents come to me and say, I don't know what to post, I don't know what to write. Don't write anything. There's tons of information on the internet that you could repost and help your clients and prospects with interesting stories and things they may not be familiar with. So definitely go out there and do that. When you go to Health Agents Network, we'll have a bunch of these links and how to do that Google feed instructions on there. So you'll learn how to do that. And we'll send out a link to that post. Now, LinkedIn. We talked about professional networking. Definitely LinkedIn's a way to do that as well. You can connect with other local professionals. You can also post the same stories. You can cross-post on Facebook and LinkedIn as well. So LinkedIn, of course, definitely more professional based, but if you are trying to get in front of a estate planning attorney, friend them on LinkedIn. You can learn some things about them. Maybe you have a common interest, common school, common friends, and that could spark the conversation. So again, news stories, industry information, it's definitely more professional site, so stick with more professional stories. Now, I get asked all the time too about what about advertising? What about Google AdWords? What about local publications and all these other things? You know what? that's hit and miss. It depends on what's available in your area. Some communities have very specific publications for seniors, some don't. I would suggest going to your local senior center or maybe your local senior living community, go to their clubhouse or go to the senior center and see what publications are laying around. See what people are reading, and then that's where you want to advertise. Maybe you are working in a smaller community and have a local paper that may be more affordable to advertise in than a major publication in a metropolitan area. So again, just go to the local publications and check them out. A lot of parishes have their own little Sunday guide or Sunday publication that they put out to their parishioners. Go ahead and check those out as well. You could advertise in there. So really, it just depends on what the cost is and who's reading it. So that's a little harder to answer. But one way, because I get asked about Google AdWords a lot, one way to show up on Google, and this is something that if you do nothing else today, do this. We're going to get to in a second. I forgot about this slide. Sorry. One thing you can do is write for local publication. So this is free. A lot of these publications are looking for writers. If you're not a professional writer, neither am I, and I run a blog. So you don't have to be professional. Just write like you speak. There's lots of programs out there to help you do that. But simply just write a quick article, ask how many words they need, write about choosing the proper Medicare supplement policy, what to look for in a Medicare supplement, how they're priced, community issue or attained age base. You can write about that. It could be a simple article and go out there and do that. And it's great for SEO because as they publish these things online, you'll be tagged as the author and you'll show up more in Google searches. But this is the bonus material I'm talking about. So let's talk about food because I love food. I'm sure we all enjoy food because we need food. And let's say it's Friday night. You had a long day at work, lots of appointments, lots of sales. You come home and you don't feel like cooking. So you open up Google and you decide you Google pizza. So what comes up? The first thing that comes up are the paid advertisements at the very top there. You see Domino's Pizza Online. That's a paid advertisement. Now, I can tell you most people will scroll right past that. There's a very small percentage of people that will pick on or click on the ads. The second thing that Google's really focusing on are local search results. Here's what's in your area based on your IP address, which is the address of your computer relative to the internet. So like here, this knows that this search took place in Des Moines, Iowa. And I'm stealing this from a friend of mine, these slides. So it knows it was in Des Moines, Iowa. So, close to me, there's Fong's Pizza, Domino's, something Italian. It knows that close to me, these places exist. And then the last is organic searches. These are searches that didn't pay to come up. They just do it naturally through Google. So a big focus now is being on local because Google's finding that a lot of people are choosing more local businesses, especially when they're looking for something in their community. So how do you, as an insurance agent, get on those local search results? So when someone searches Medicare supplement Atlanta, Georgia, how do you show up in the local result? Glad you asked. Here's how you do it. You have to do it through NAP, which is name, address, and phone number consistency. So here's a Google search here for Rocket Referrals. A good friend of mine is the CEO there. Great program. If you haven't checked it out, it's rocketreferrals.com. They work on online referrals. So check them out, but they put this together for me. So here's how they show up in the local search results. First thing, they actually have a physical address. As you can see there, their physical address is 206 6th Avenue, Suite 700, Des Moines, Iowa. So it's not a P.O. box. It's their actual physical address. Now the question comes up, which already came up in the question area, what about if I office on my home? Put your home address on there. I guarantee that if I'm looking that hard to see where you live, I'll find it through other searches. I could do it through the Department of Insurance website for most states. So don't be afraid to put your home address on there. That's fine. But a physical address works far better than a P.O. box because a P.O. box tells Google that you might not be local. So you want to show up in the local search results. Second thing is the phone number. Put a local number. Notice that they don't have an 800 number there. Rocket Referrals has a 1-800 number, but to get listed on NAP and have the NAP consistency and show up on the Google search, they put the local number. It shows that, hey, we really are local in Des Moines. We're not just saying we are, because here's a local number. And the last thing is the name, Rocket Referrals. I know that was first on here, but I want to make sure you focus on the name of your agency. So in my case, if I was Mike Gatorna Agency, I want to make sure that's significant across the web, because Michael Gatorna Agency and Mike Gatorna Agency could be two very different things. You need that consistency. So you want to have consistency across the board, because otherwise Google may separate Mike and Michael even though it's the same person. So here, of course, Rocket Referrals is pretty easy, but you want to make sure that you have all the information on there. And you want to just not do it on Google, you want to do it on every website possible. So the challenge there is there's millions and millions of websites. How do you do that? Well, I have no affiliation with Moz. Neither does Bankers that I know of, and neither does Rocket Referrals. So no one that I know of has an affiliation with Moz, but they are a data aggregate company, if you would. And what they do, and they do SEO results and such, but if you go to moz.com/local, for $84 a year, they will take your information and make sure it's standardized across the web, because Google pulls from millions of different sources, millions and hundreds of different or data aggregates, which are companies that just collect data. So Moz will make sure that your name, your phone number, your address, all your information is listed properly. Side note, when you are registering yourself on one of these places and ask what you are, do not put insurance company, put insurance agent or agency. If you put insurance company, it may think that you're a carrier and take you out of more personalized results. So a little something we found by trial and error. So put insurance agency, not insurance company, because think of company as carrier and agency as agent. But basically how it works, you enter your information, they publish it out there, and then search engines can find you much easier. Again, I have no affiliation with them, but this is the most cost-efficient way that I found to take your information and blast it through the web and make sure it's consistent. And then you start typing in, Mike Gatorna, or excuse me, you start typing in insurance agent in Atlanta, Georgia, and hopefully you'll see yourself start coming up. But you definitely have to do something like this. You can't just pick Google and be done with it, because Google's going to search itself, but it's also going to search all these other sites. And if it sees that, if you're Joe and it sees Bob, and Bob is consistent across, 30 different websites, and you're consistent across one, he's going to move up above you. And, you want to be the first one listed as fast as humanly possible. So Google your name. Google your agency name, see if you show up. If you do, great. If you don't, claim your spot. And then definitely go to moz.com/local and check it out. So if you take away nothing from this webinar today, take away this, because this will save you lots of headache and it'll get you listed on Google faster than anything I have seen. So what to do next? Check your local listing, as I said. Go to Google, Google yourself as an agent, and see what other people are doing. Also, Google where you are, insurance agent or Medicare. So if you're I'm in Columbia, Missouri, so I would type in Columbia, Missouri Medicare agent, or Medicare Columbia, Missouri, or Medicare supplement. All these different threads of search engine or search results, go ahead and do that and see what comes up under local listings. And if you find your name, you have to claim it. So claim it, make it your own, and then go to Moz and check it out. Join one civic organization. Go out there and just be a guest. You can go in there a lot of times. The first, second, third time you can go as free. You can get a feel for it before you sign up a membership. A lot of times if you're a small agency or a one-man or one-woman shop, you can go ahead and join for minimal costs, because a lot of times they base it on the size of your organization. So if you're one person, it could be relatively inexpensive. Write a comp for a local publication. Go out to local publications and offer to be a guest author. It's free. You'll get your name out there. You could put it on your website. Hey, check out my latest article here. Again, it makes you look like more professional. And then set up a seminar. Go ahead and set up a seminar at your local library, community center, at a civic organization, somewhere, and just talk about Medicare. You don't need a projector. You don't need a slideshow. You can just have a quick 15, 20-minute conversation about Medicare. And if you need help with that, we've got resources on Health Agents Network and also on Bankers Online Training. So one person asked, what do you mean by claiming your name? If you ever do a Google search or let's say you're Googling an auto repair shop, and this auto repair shop's a small little place in the corner of town that no one really knows about. They may not have claimed their name. So if you're searching Bob's Auto Shop and you search it and it comes up in search results, he may not have claimed or have a Google listing. If someone doesn't have a Google listing, it lets you claim it. So you could be, hey, that's my business. That's me you're indexing. I want to make sure that I'm the one updating the information. So else there'll be a button right there on Google saying claim this address or claim this business. And you hit that, and that way Google knows it's yours. You may not have a Google listing, but let's say you were in the Yellow Pages 2 years ago. It will pull from there. Let's say you have a website, but you never claimed a local business on Google. It will pull information from your website. So just because you haven't done it doesn't mean Google's not finding it somewhere on the web. So just like I said, Google yourself or Google insurance agent in your area, or obviously in your town, wherever you live, or Medicare supplement policy, Columbia, Missouri, and see what comes up. So if you find your name coming up and it says claim it, that means no one says they're you yet, which is good. And you want to claim that information, make it your own, so Google knows that, hey, this is a real live person still active. Because that's the thing, is the more inactive you are, the less you'll start coming up. Because as more people claim their information, Google knows it's valid. Again, let's say Bob's Auto Repair Shop that was in the corner of town went out of business last year. Well, they're not going to claim that business, so as that business sits on the internet unclaimed longer and longer, it will become off of Google searches because Google thinks, you know what, this business may not be in business anymore. There's no way for Google or any search engine to know what's still in business from this year to last year unless they do a post or pull their business offline. So let me know if that hopefully answers your question. Again, just play with the Google a little bit, and that should help you out. Oh, there we go. There we go. Okay, sorry about that little glitch in the internet there, but we are back. So yeah, again, just go to Google, play with some different search results, and look for your name and again claim it. So again, there'll be instructions on Health Agents Network and on Bolt Bankers Online Training on how to do these things. So sorry about that little hiccup on the internet there. But that was pretty much the end. So go ahead and check out Health Agents Network. It's open access, free for anyone to go in there and download materials. Bankers Online Training for bankers, contracted agents. So any other questions, comments, concerns, I'll be on here for another couple of minutes. Otherwise, thank you very much for attending. Hopefully you got some good information. Again, we'll have the links and resources posted either later today or tomorrow on Health Agents Network, and we'll do an e-blast too to make sure you get all the relevant information. So thank you again. Go out there, become a local area expert, and again, if you need help, call Bankers. They're more than willing to help you out and make sure you're a success. So go out there, have fun, make money, and give impeccable service. Thanks, everyone.